Hey guys, Dr. Ray Marque here of Back Pain Relief Center. This is our Monday edition of Dr. Ray TV. And today we're going to talk to you a little bit about manipulation under anesthesia and what's it all about. So manipulation under anesthesia is a procedure that I do, and I've been doing it now for about 4 or 5 years, and we've done hundreds of cases and helped a lot of people suffering with chronic pain conditions. So first off, when we say chronic pain conditions and we relate it to manipulation under anesthesia, we're only talking about the chronic pain conditions that have an adhesive or fibrous tissue buildup in the muscles of the joints as part of their syndrome. So not all chronic pain patients will respond to manipulation under anesthesia, but ones that are degenerating and have a component that makes the muscles very tight and the joints less functional, manipulation under anesthesia may be the key to bring that function back. So your chronic pain condition would have to have a component where there's a marked reduction in range of motion. I can't bend over as much. I can't comb my hair anymore. I can't twist, or I can't get my reach and get my wallet out of my back pocket. It has to have a component like that. Some of the conditions that traditionally are treated with manipulation under anesthesia, or MUA, is fibromyalgia is a big one. Frozen shoulder syndrome or adhesive capsulitis, and some chronic non-responsive neck and back problems. And a couple others like hip and knee problems, which I don't see as much, but they can also respond. So what is MUA, or manipulation under anesthesia? Well, manipulation under anesthesia is a procedure where we sedate the patient where they're asleep, and we do it in a surgical setting, most of the time in an outpatient surgery center, so somewhere you come in and leave the same day, not a hospital. And what happens, we put the patient to sleep, and then what we do is put them through a series of myofascial or muscle and joint articular manipulations and stretches in order to break up that scar tissue. So what is a scar tissue? So what am I talking about this whole thing? So some conditions out there, as part of the component of their syndrome, the muscles in the joints build up scar tissue or collagen formation in the joints, or fibrous tissue buildup. And many times that happens from dysfunction of the muscles in the joint. So say a particular joint isn't working correctly, and the muscles are gliding just a little abnormally day in and day out, and when they rub against each other, they build up friction. Your body doesn't like it. It forms or puts collagen in between the muscles and in the joints to stop that particular motion from building up more friction. And what happens is it very slowly decreases range of motion. We see it a lot in fibromyalgia because those patients have a propensity to build up more fibrous tissue buildup or collagen, and that could be from genetics to biomechanical, and there's a lot of reasons in there. Some other things that we see is repetitive motion. So a lot of, especially in New Jersey, a lot of our people that work in factories, so they're lifting molds day in and day out, or they're pushing boxes up, or they're folding papers, or whatever they're doing, but those muscles do the same things day in, day out. They traditionally can build up some adhesions in there. Also, neck and back problems, because they dysfunction, they build up scar tissue around the joints. Some post-surgical things too. So sometimes people have a shoulder, and we'll get into this a little more later, but sometimes you have a shoulder surgery, just the act of the surgery itself builds up fibrous tissue. If it wasn't broken up in physical therapy, then we have this addition to this additional component to the joint that reduces motion. So when we say manipulation under anesthesia, the manipulation is kind of a misnomer because it's not the biggest part of the procedure. Majority of the procedure, I want to say 90% or 85% of the procedure, is actually some very aggressive stretches and soft tissue manipulation, where I'm using my hands and my thumbs and my fingers to break up the scar tissue, and we're stretching it and we're regaining that range of motion. So why do we need to put the patient to sleep? Well, a couple reasons. Number one, or one of the biggest reasons, is because of the pain. It's a very aggressive form of manipulation or therapy where if we were to do it to you while you're awake, you wouldn't like it, and it would cause some pain. Number two, some patients just can't handle the therapy component of it. Are you know, there's a lot of people out there that say, hey, I went to physical therapy and it felt like it made me worse, and it was hard to do because it was so painful the whole time. Well, some people get that where their pain levels are so high that the therapy that would probably help them the most, they can't do because they're in so much pain. And they get there and they guard, and that means they kind of like clinch up, and they their muscles will spasm and they'll react, and they have a hard time getting the therapy that will probably help them the most. So that's why we put people to sleep. And then while you're to sleep, the muscles are much more loose. We can put you through a greater range of motion, and we can really get in there and break that scar tissue up. Again, I said it's done in a surgical setting. We have the aid of the OR nurses, the anesthesiologist, and an additional doctor if we need to help counterbalance or stretch the different joints. Let's go back to a couple of the conditions. So fibromyalgia. People with fibromyalgia have this propensity to build up scar tissue or adhesions or collagen, all kind of the same thing, in their muscles and the joints all over. So their body just aches. And mere movement, walking around, makes it ache even more because they have so much of it. And we've been very successful in the past if we stretch those muscles out, break up those adhesions, loosen everything up. They regain some of the mobility, and it's less painful for them to move around. The bonus part of that, and what we've seen with a lot of our patients, is not only do they gain that range of motion, but now they can go out and they can walk, or they can exercise a little bit, or they can work in the backyard, and they begin to regain a little bit of their life. So there's a big pain component that it helps with, and there's a functional component which is even greater. I think that the second most common one we do is frozen shoulder syndrome. So frozen shoulder syndrome, and we've talked about this a little bit before, is adhesive capsulitis of the shoulder, where the shoulder actually adheses or freezes up with that scar tissue formation around the joints and muscles, and it doesn't allow the patient to move that shoulder. And I've seen some pretty extreme cases where people can't even comb their hair, and they can barely even lift their shoulder. It happens a couple different ways, sometimes following shoulder injuries or surgery. And then sometimes it's unknown. People just get it every once in a while. And there's a lot of literature out there saying, hey, we don't know how they get it, but they know why it's not working. So very, very successful with frozen shoulder. I've done quite a few of them. I want to say, even with all my MUA patients, we're looking like at a 90% success rate in restoring function and range of motion. Chronic neck and back problems. So why don't we just manipulate you or treat you in the office? Well, you know what? We do almost everybody, okay? Manipulation under anesthesia, or MUA, is only for a limited amount of patients. Very few of our patients get this done. And they're the worst case scenario patients. And how it typically works is patients that have gone through treatment. They've tried physical therapy. They've tried injections. They've tried chiropractic. They've tried acupuncture. They've tried all these things, and they keep on getting back to the same position. So they may feel better for a little while, and then it comes back, and then they feel worse. And it's an ongoing cyclical type of syndrome that they can't get better, and they don't want to do surgery. This MUA is like the last straw, last attempt of therapy before we talk about surgery. So it's a last ditch effort, maybe you want to say. So chronic neck and back, like again, we only do them on a few of them, and they're the patients that have been in pain so long and have tried so many things and always seem to get back to that same position. So this isn't for the person that just hurt their back in their backyard or hurt their neck in a sporting event. It's for patients that don't respond to traditional care and aren't getting to a place that's manageable for them, and it's a great way to increase their range of motion. There are some other conditions like knees. I haven't done too many knees, but that's usually following a knee surgery or a knee replacement. Those we'll be careful with. I would probably refer you back to the orthopedic before we would do that. We do see quite a few hips, because hips seem to tie right in with the pelvis and the lumbar spine, where they begin to build up a lot of scar tissue in the muscles and joints and restrict that range of motion. How is this whole thing done? So we put you to sleep in a surgical setting. We do it in a series of 3 treatments. And I know it's a little bit of a pain in the butt, but all the research and all the trials have pointed us to about 3, kind of the magic number. And we do 3 different times. It's usually once a week. If we're up in New Jersey, I do them on Wednesdays. So we do the procedure. You have to have someone bring you to drive you home. The procedure itself lasts about 20-25 minutes, so we have you to sleep for about 25 minutes as we're working on you. The pre-op to get in there probably takes an hour or so, and then however long it takes you to wake up. So I'm going to say 3 hours or so to get you in and out. And almost everyone can go to work the next day, minus some of our frozen shoulder patients. There is some soreness to be expected, and that soreness many times has been described as like the first workout of the year. Oops, I just kicked my phone. The first workout of the year, and you're sore, and that's typically what patients come back as. A lot of different variations of that. Some people feel great and don't feel anything at all. Some people are a little sore. Series of 3, we do them once a week. There is a period of time that research has told us that people respond the most. So the most gains after manipulation under anesthesia is done is the 4 to 6 weeks following the procedure. And that's when you'll come to see me a couple times a week. We'll stretch out even more. You're going to be doing a lot of stretches every single day from then on in order to keep it. Because once we break up the adhesions and the scar tissue formation and we restore that range of motion, there's no reason for that dysfunction to come back if you continue doing your therapy or continue doing your stretches. So not that you have to see me after that 4 weeks or so, but you'll continue doing some type of stretches. And most people at this point want to do them because they're regaining their life back and able to do things like that. All right, I hope that helps a little bit because we get a lot of questions. I get a lot of questions if it's safe. Let's go over that, this safe part. You know, I've done 300 or 400 of them. I haven't had to repeat any of them. I shouldn't say that. We've repeated a couple of them, a small portion of them. They're completely safe. We barely have you under. You have multiple eyes watching you. There's low risk in injuring something as long as we know your body and we know your limits and your function. It's covered by most insurance companies. That's another big question we get. Everyone has different coverage. Everyone's percentages are covered at different costs. So if you have questions about if it's covered by insurance, just give us a call at the office, and Gina will definitely look into it and see if it's covered. We do have cash fees also if need be that would make it affordable for you. All right, I think that helps. I'm trying to think, is there anything else I want to talk about it? The biggest thing is that it restores your function, it restores your life. It allows you to do things that you weren't able to do before. All right, I hope that helps. You can always go to our website. You can just look up Chronic Pain New Jersey or Manipulation Under Anesthesia in Vineland, and it'll pop up. If you're in New Jersey, go to backpainrc.com. Again, that's backpainrc, backpainreliefcenter.com. And you can get information from our website there. If you're down in Myrtle Beach, it's myrtlebeachwalkinchiro.com, myrtlebeachwalkinchiro.com. You can get some information there also. As always, you can always just message me, and I will definitely get right back to you, and we can talk about it. All right, I hope all is well. Hopefully you don't need me, but if you do, we're here for you. It's a walk-in clinic. Stop in anytime. Bye-bye.